So I'll be sharing 4 big groups of items today. First, I'll actually explain a little bit what exactly is a healthy gut. And then, as YP mentioned just now, how can the unhealthy gut affect my health? Then what can I do to actually improve my gut? And lastly, I will just share with you all what are the dietary management for common gut problems. So what exactly is a healthy gut? Is it just means that we can pass motion every day, we don't vomit, that is a healthy gut? So it's actually a little bit more than that. So you can actually know that a healthy gut is actually equivalent to a healthy microbiota in our intestines. So microbiota, essentially, it's a group of very varied and diverse bacteria, viruses, and even fungi in our intestinal inside our intestines. So if there are actually a good, diverse, healthy population of all these bacteria and microbes inside our intestines, it then actually forms a healthy gut. So there are more and more science and evidence that actually come to show that if a person is unhealthy, there is actually significant changes in this microbiota in their intestines. So just some interesting facts about this microbiota in our intestines. So there are actually 100 trillion types of different microbiota inside our gut. And in our body, our gut has the most number of different microbiota inside. And if you actually could isolate them out, it will actually weigh about 2 kg of your weight. And of course, if you want to line them up one by one, you can potentially go around the Earth about 2.5 times. So this just want to give you an idea how many different types of microbiota we have in our intestines. And of course, quite a number of our illnesses can potentially be linked back to the unhealthy microbiota. I will share a little bit more. So why exactly is microbiota so important? Because not only does it help us digest our food, it also, after digesting the food, help us produce essential vitamins that will be important to our health, like vitamin B. If you have a good population of microbiota, in fact, it actually helps control your appetite, and you will not want to eat so much. And other than that, it will also help develop and control your immune system. And importantly, they also have a very significant impact on your mood as well. Of course, similarly, if there's any problems with the slides as mentioned, this is all via virtually. Feel free to let me know or text YP, then we will try to sort it out. If there were anything that was mentioned earlier and it wasn't very clear, feel free to let me know, and we also address some of your concerns and queries at the end of the session as well. Thank you. So we're just sharing about the microbiota and how it's very important to us. Essentially, it's actually not just important for humans, but also very important for our animals as well. For those who like to watch Discovery Channel or like to read about animals, one very interesting thing is actually a lot of our animals practice this thing called coprophagia, which means eating the feces. So specifically, one particular species is actually koala bear. So for a baby koala bear, essentially you should try not to separate the baby from the mommy koala bear if it's possible. If you really have to, you will need to feed the baby koala bear some part of the mommy koala bear's feces. And the reason is because the mommy's koala bear feces contain a lot of very healthy bacteria, for which the baby koala bear actually do not have them. So the baby koala bear eating the mommy's koala bear species, right? It actually increased the microbiota within the baby's koala bear's intestines so that they can actually digest eucalyptus leaves properly. Because if they actually don't eat it, they will then have problems later on in their life to digest the eucalyptus tree. And usually, in this case, they usually won't grow very well. Okay. And in fact, long time ago in the 4th century, a traditional Chinese physician, Ge Hong, has also used feces in the part of treatment for patients who have diarrhea. So he actually makes liquid stools as medicine and actually serve it to patients who are having severe diarrhea. Then, of course, there is also anecdotal effect that it helps them as well. Then the 16th century, there's Li Shizhen. I think many people have heard of him before, where he actually used dried feces and use it as a form of medicine to actually help patients who are also having food poisoning symptoms. And if you read the newspaper in 2014, we have really actually started fecal microbiota transplant, FMT in short. So essentially, we use this therapy mainly for patients who have had severe colonic bacterial infection called Clostridium infection. So this particular FMT or stool transplant has actually been shown to help patients with severe Clostridium that is actually very difficult to treat with the existing antibiotics that we have. So the earlier examples is mainly to highlight that our intestine bacteria plays a very important role in our health. It helps us digest our food properly, and in fact also improve our immune system to fight against illness like the colonic bacterial infection that I mentioned earlier. So there are actually multiple factors that can affect our intestines microbiota. For example, whether the baby is born through cesarean or is it through a normal vaginal delivery. Then other things will be after delivery, whether what the young child or the baby have eaten, whether it's purely breastfeeding or there's some form of formula feeding, and when do you introduce the solid food, and if the child was actually exposed to illnesses during young time or recurrent usage of antibiotics. All of this can actually affect the gut health in the future and potentially may increase the potential likelihood of illnesses as they get older. For young child who have been recurrently exposed to antibiotic when they are very young, there is some study that seem to suggest that when they grow up, they are a little bit more prone to get immune-related diseases. For example, things like hyperactive immune system that tend to attack their own body. So other things is environmental factors as well. So for environmental factors, there is diet, which plays a very important role in our bacteria in the intestines. I will explain a little bit more shortly about how diet affects our intestine bacteria and also whether we're exposed to animals early in our life. In fact, if a young child has been exposed to animals early in their life, there are some studies that suggest that they are also less likely to get infection later on, and also less likely to get hyperimmune diseases later on, or what we call autoimmune diseases. Then, of course, as we become adult, certain lifestyle measures like smoking, usage of certain medication, or very unhealthy diet can actually cause changes in our intestine health. And of course, if we are actually subjected to very stressful environment, it can actually also affect our intestine health. So to summarize, actually, we are what we eat. A lot of things, our health is actually strongly dependent on the type of food we put inside our body, which is why I will be explaining a little bit more to you why. So if you see this rather busy chart, the top part is how diverse the diet is. The more colors you see, the more diverse you are. And the bottom part of the chart is the gut microbiota. The more colorful it is, the more diverse the microbiota is. Then as the chart from the left goes to the right is as we get older. So on the extreme left is when we are baby state, when we solely drink breast milk or formula milk as the only form of diet. You can see that our microbiota is essentially very little and there's not much diversity. Then as we get older, toddler phase, and we start to eat solid food, we start to actually put more things in our mouth as young children. You can see that the microbiota diversity starts to grow more and more until we become adulthood, where we generally reach a steady state. However, as mentioned just now, when we reach a steady state, multiple other environmental factors can cause changes. For example, smoking, alcohol usage, and even usage of medications like antibiotics. And most significantly is actually if, for example, we migrate from one country, for example, Singapore to America, there will be significant changes in the type of food that we eat. And that will actually cause significant changes in the diversity of our microbiota. So to just expound more on the topic that I mentioned earlier, there was a study that is done where Asians moved to America. You can see in the picture on the left side, pre-immigration, they tend to have a lot of different types of gut bacteria. That's why you can see different colors, different shapes and all this. Then once they start moving to America, where predominantly will be Western diet, which is high in red meat, high in fats, processed food, and low in fiber vegetables. So you can see over time, the microbiota diversity actually reduces. And also we have also observed that when this happens, the people also tend to put on weight as the microbiota diversity changes. So what if somebody have an unhealthy gut? How does it really affect their health? So this slide, I just wanted to show the potential association that our scientists have identified so far based on the studies that they have done. So important groups of places that are being affected by unhealthy gut will include that of the heart, the liver, the brain, and even it can cause obesity, diabetes, and it also can increase the chances of developing low-grade inflammation. Inflammation just means a lot of irritation within the joints and within the body itself, or even within the skin, which is things like allergy, eczema, arthritis. So this complex slide essentially just wanted to put it here to just show that actually different things can actually affect our intestinal health. So if you take a lot of red meat and processed meat, there will be some chemical reaction that happens in our intestines. Then the bad bacteria in our intestine will produce more chemicals that can potentially damage the cells within our intestines, increasing the chance of us having more inflammation and also abnormal hormones secreted in our body. And of course, as mentioned, many people have heard about how the gut health can actually affect their mood. So for those who have heard about this condition called irritable bowel syndrome, for patients who have heard about this, I usually tell my patient that the brain and the intestines are actually linked. So when a patient actually have a rather unhealthy gut, it can actually send a lot of signals to the brain and then potentially affect the patient's mood as well. So there are some animal studies that shown that depressed mice who has very unhealthy intestinal bacteria, the intestinal bacteria has been transplanted into healthy mice, and the healthy mice then start developing depression-like symptoms. Everything the same, it's just the change in the microbiome in the mice, and they have observed that this mice has demonstrated depressive symptoms. So there is definitely some link between our gut health and our mood. And for irritable bowel syndrome is essentially when the intestines may have some unhealthy population of microbiota in the intestines, resulting in some signal changes in the brain. And then they also tend to get anxiety type symptoms. They also may tend to get some things like cramps, diarrhea, or sometimes even constipation as well. And also, the microbiota, as mentioned earlier, can actually result in obesity as well. So the science have actually observed that the lean people and the obese people actually have very different populations of bacteria within the body. And in fact, there are actually ongoing studies as to whether changes in this microbiota can actually change a person's health and weight as well. There are some animal studies that may be suggestive, but for human study-wise, the jury is still out there. So please don't change, don't do anything at this moment, there will be more evidence coming on in the future. And also the microbiota can actually be associated with diabetes if it's unhealthy. So essentially on the left is the group of people who has normal intestinal microbiota, and on the right are people with unhealthy microbiota. So you can see the red color chart in the middle. The more red you have the unhealthy type of bacteria in the gut. So you can see that patients who are on the more obese side tend to have more unhealthy intestinal bacteria. And this unhealthy bacteria subsequently would then result in our body not being as sensitive to insulin, predisposes patients to develop diabetes. Next is actually the association of intestinal health and cancer. So a lot of our food can actually potentially affect the chances of for us to develop cancer. So for the food pipe cancer or esophageal gullet cancer, it has been associated with increased usage of alcoholic drinks, more so for Asians, especially Asians who, after drinking small amount of alcohol, they tend to get the Asian flush. For people with this type of problems, if you drink a lot, then the alcohol will definitely increase the risk of the gullet cancer for this group of people. Then if you see mate, right, essentially it's a type of it's a traditional South American drink that is actually drank through when it's almost at boiling or very, very hot temperature. So it has been shown that if we have the habit of drinking very, very hot drink without actually waiting for it to cool down, it also increases the risk of food pipe cancer. Then, of course, lastly, things that can potentially reduce risk would be things like vegetables, fruits, and physical activities. So not only does diet affect the risk of our food pipe cancer, it does also affect the risk of our stomach cancer as well. So in general, as you can see, alcohol, not only does it increases the risk of food pipe cancer, it does actually also increase the risk of stomach cancer. And for those who like to eat preserved food, there is also a suggestion that food that have been preserved by salt process, like the salted fish, salted eggs, all this does actually increases the risk of stomach cancer as well. Then, of course, if you like to eat processed food, it has also been observed to have a slightly higher risk. Then, of course, fresh fruits in general can actually reduce the risk. Lastly, it's about colon cancer and its association with diet. So for colon cancer itself, processed meat, alcoholic drinks, and body fat, all this actually has been associated with an increased risk of colon cancer. Then things that help us reduce the risk will be things like physical activities, whole grain food, food that is high in fiber, dairy products, and calcium. All these tend to help us reduce the risk of colon cancer. Of course, red meat itself will also increase the risk of colon cancer. So before anybody decides to start to change the microbiota on your, please don't. The reason why I'm saying that is what I presented to you earlier are actually more on the preclinical side of the evidence, meaning most of them are evidence done through investigation using animal models. Human models wise, we have not really actually used it on human models, but now there are more increasing evidence that this is actually something that we are getting a better understanding on. I would foresee in the very near future, there will be more and more human testing, for which eventually we will have a more refined way to help our patients improve their gut health rather than just eating the feces itself. So stand by, I would foresee in the next decade or so, there will be actually a lot of interest in this, and there will be definitely more refined methods to help improve our microbiota. So definitely to improve your gut health, please don't look at the feces. There are other better methods which I will share at this moment while we wait for more concrete evidence on what is the best way to help. So then mainly will be to focus on our diet because this is something that we can control easily. So are all bugs actually bad for our gut health? So the answer is no, because we have to understand that for the bacteria or the bugs inside our intestines, we generally divide them into two camps. One is the good bacteria that will fight against the different population, which is the bad bacteria. So to improve the population of our good bacteria, we have prebiotics and probiotics. In case you're wondering what exactly is pre or probiotics, there are two very different things. To put it simply, prebiotics are actually food for our good bacteria. So if you eat a lot of food that is rich in fiber or roughage, this type of fiber is usually not digested in our intestines. Then the good bacteria will thrive on this type of this type of fiber, and then they will grow in greater population. So some prebiotic food, as seen in the comic, will be things like apples, garlic, onion, bananas, asparagus. Then, of course, if you take a lot of low fiber food, for example, pizza, mashed potatoes, all this, you actually will have a reduced population of the good bacteria in your gut. One important thing to note is while we are saying we should take more fiber, if you are usually a Western diet person, meaning you eat predominantly meat and you rarely take fiber, if you suddenly overnight change your diet significantly and you take a large amount of fiber, a lot more than your usual, you may feel very uncomfortable because your body may not be used to the very sudden change in the diet. And a sudden change from low to very high fiber diet will result in a lot of bloating and gas formation. So a lot of patients, if they change, they say, oh, no, high fiber is not suitable for me. Let's go back to my usual steak and chicken. Yeah, so do it gradually, especially if you are not used to having a high fiber diet. I would suggest for you to go slow so that you will not feel so much bloating in the process of trying to convert to a higher fiber diet. Next is probiotics. Probiotics are essentially live bacteria, the good bacteria for our gut that we can eat through the normal way. So of course, yogurt, as many of you would know, essentially is a form of live bacteria, or Yakult, Vitagen are also live bacteria. So for those who like a more refined version, you can always take probiotic in the form of capsules, which can be found in the pharmacies, and they usually do not need a prescription. Then for those who prefer drinks, kombucha, kefir, and also the yogurt drinks in general also contain a lot of live bacteria that is good for your gut. So this busy slide essentially just compares how different diet can impact on our intestinal health. So specifically, maybe I would just ask you to focus on the extreme right to compare between Western diet and Mediterranean diet. So you can see that in general, Western diet that is very high in fats, more red meat and processed food actually reduces the diversity of our microbiota. And when the microbiota diversity actually reduces, then the intestinal cells' health actually become unhealthy. And that resulted in a lot more inflammation, and then diseases will eventually come on later. However, there seems to be some studies that suggest that Mediterranean diet tend to improve our intestinal health, and also, which is also suggestive why Mediterranean diet people tend to have lower risk of heart diseases and other illnesses. So to just put it in easier to understand way to compare between Mediterranean on the left and Western diet on the right, so you can see that there's this pyramid. Essentially, the pyramid is the widest one is where a person eat the most of. So Mediterranean is the pyramid on the left, and the Western is the inverted pyramid on the right. So to compare the difference, the Mediterranean diet essentially is high in fiber, lots of fresh fruits and vegetables, and in general, they tend to eat whole natural food. That means they don't actually process the food and make it into other forms of diet, which I'll explain a bit more. So they just cook the chicken and just eat it, rather than mashing it up and making it into nuggets and all this, which are processed food. And in addition, Mediterranean food is predominantly also plant-based, way more than just meat. In comparison, the Western food is high in red meat, refined sugar, lots of salt, lots of like cakes, sugars, desserts type of food. They are generally very low in fiber, and they don't really have so much natural food, but mainly processed food, and it's predominantly meat more than plant-based. So to explain a little bit more what exactly Mediterranean food is like, essentially it is mainly fresh fruits and vegetables, a lot more whole grain food. And for oil, they tend to use olive oil, not so much animal fats or saturated oil like butter or margarine. Then they also may take meat like fish and seafood, and generally it's rich in omega-3. Then generally they take lesser in terms of dairy, poultry, and red meat, and also sugar. Unfortunately, there isn't a lot of data that compares between Asian diet, Western diet, and Mediterranean diet. So I don't really have a data on how Asian diet significantly affects our microbiota in comparison with the Western diet. But if you can see, if I put it side by side between Asian diet and Western diet, our Asian diet generally contains a lot more grains, and is generally more complex carbohydrates, and it's a bit lower on simple carbohydrates, and we are high in vegetables and fruits, generally low in meat, low in processed food, and also not so high in fats. However, this type of typical Asian diet is probably what our grandparents' era are eating, because I'm sure you know that in recent years, at least within Singapore, our diet is slowly moving towards more of a Western-like diet, where most of us tend to favor more red meat, and we tend to take more desserts, more animal fats, and we also tend to take less grains. And even if we want to eat, we tend to eat white rice, which is actually lower in fiber, and they are all more towards simple carbohydrates. And we also drink a lot more Coca-Cola, Sprite, which contains a lot of simple carbohydrates or simple sugar that is generally not so good for our health. So this slide just summarizes the difference between a healthy diet on the right versus a not so healthy diet on the left. I think many of us can look at this and realize that actually a lot of our Singapore diet is more leaning towards the left in recent years. So to summarize the various steps to a healthier gut, I just put them into do's and don'ts. Oops. Okay. So basically for the do's, we need to actually take more, sorry, that is, apologies for that. There is something wrong with my, let me try the screen again, thank you. All right, so to summarize, essentially, the steps to a healthier gut is actually to increase our fiber intake. And when we eat fiber, we should aim to get more fresh fruits and vegetables, not so much of the preserved type of food, because I do know that many of us enjoy preserved fruits and vegetables. But of course, in general, those may be not as healthy. You should aim for more of the fresh fruits and vegetables. And if you want to eat meat, you can actually avoid the red meat and take more white meat, for example, like chicken, fish. Getting enough sleep and reducing stress if you can are also helpful to get a healthier microbiota in our intestines. So the things that we should try to minimize is to minimize processed food. So processed food will be things like nuggets, French fries, all these are processed food, or even potato chips, which many of us, I'm sure, enjoy. Then reducing refined sugar intake from things like cakes, pastries, reduce refined oil, meaning less lard, butter, margarine, reduce alcoholic intake, avoid smoking, and importantly, take antibiotics only when it's needed, because there are some people who sometimes like to take more antibiotics in hope that they will actually remove the flu-like symptoms faster. But of course, if it's a common cold, most of the time it is actually due to a virus infection. And taking antibiotics usually doesn't help the viral infection, and it, in fact, can actually exacerbate the symptoms because antibiotics tend to have more side effects and you can get nausea, even diarrhea as well. So do note that for common cold, avoid taking antibiotics or asking the GP to just give you antibiotics so that you can get better faster. Because most of the time, what you need is more rest, more water, and you will generally get better on your own. Okay. Next, I will just share, moving away from the microbiota, I will just share a bit more about how our diet management can actually help us with our common gut symptoms and discomfort. So the first thing is dyspepsia, or what we call refer to commonly as gastric pain, and also reflux. So the common food triggers that we have would include things that are very sour, acidic, for example, coffee, tea, citrus fruits and juices. Generally, these are more acidic. So of course, acidic food tend to cause you to have more gastric discomfort. Then carbonated drinks. All the gases you see inside, right, is actually carbon dioxide that is actually compressed within a can to dissolve it inside. So the carbon dioxide actually resulted in increased acidity within the drink. So which is why when you drink this kind of soft drink, usually they taste slightly sour. Yeah, because acidic things in general are a bit on the sour side, like coffee without the milk. Then next thing will be fatty food, fried food, spicy food like the mala hot pot, and also alcohol, which is a common thing that many of us drink. And one important thing I want to share about alcohol, it is a direct irritant for stomach. So for those who like to drink concentrated or high concentration alcohol neat, right, directly without mixing with anything, you can really feel the fire burning sensation down your food pipe into your stomach. Yeah, so it's a direct irritant for your intestines. Okay, next, the common food triggers for reflux are things like caffeinated products like your coffee, even your Coca-Cola, tea, Red Bull, all these are high in caffeine content. Chocolates can also increases the risk of us getting reflux, and also peppermint, garlic, and onion. The reason why caffeine, chocolate, peppermint, all this can increase the risk of reflux is because there's this muscle just at the upper part of our stomach that closes to reduce the risk of food coming up into our food pipe. When you take those food mentioned earlier, what it does, it tends to relax this muscle so that the food content within the stomach can come up more easily. Okay. So the next common food triggers for bloating are things like beans, dairy products, garlic, lentils, onions, and cruciferous vegetables like broccoli, cauliflower. So then how do we combat these three symptoms, dyspepsia, reflux, and bloating, after identifying the common food triggers? So if you understand what are the common food triggers, then avoidance or minimization of exposure to those food types will actually help to reduce the risk of you having the symptoms. Then there are some lifestyle habits that you can consider to help without the need for taking medicine. So increasing your physical activities will definitely help for things like bloating and reflux. Then if a person is on the higher BMI side, then they are also more prone to having reflux symptoms as well. So if one could lose weight, they may actually also observe that the reflux symptoms do get better without the need for using medication. For those of us who are smoking, stopping smoking may actually improve your intestinal symptoms like gastric discomfort. Then if you have to use alcohol, use it in moderation. And of course, there's always an old wives' tale where you say, before you drink, you must always eat your food, right? The reason is because the food itself essentially serves as barrier so that the stomach doesn't get so irritated by the alcohol on its own directly. So that's why if you can, you try to eat something before you drink, and also avoid excessive amount of alcohol. Then for those who are actually working, we tend to wear like tight-fitting clothes, maybe tight trousers or tight skirts. And after our lunch, when we realize we sit down, it becomes even more uncomfortable. So if you can, you should wear looser fitting clothing. That will help definitely reduce the chances of bloating symptoms and also reflux symptoms as well. Then for those who like to have a late night dinner, they may observe when they lie down to sleep, they tend to have more heartburn symptoms. On average, our stomach takes about 4 hours to clear the food within the stomach. So it will be best if you could actually avoid lying down within 4 hours after a meal. Then for other dietary habits that we can consider is to take regular meals. And it's important that we eat slowly, taking about 20 to 30 minutes to finish your meal. And so that you can actually know that your body is full and reduce overeating. And in general, you stop eating once you're about 80% full. Then we have discussed about the common food triggers. If you could avoid them, that would be best. Then immediately after a meal, you try to move around. That will help you digest the food better and reduce bloating symptoms after your meal. So one question for all for us to ponder is, have you ever wondered if you could recall the days when you were out dining? Why restaurants like Fish & Co. or Hai Di Lao, the steamboat restaurant, and many other Western steak restaurants actually offer you mints like Mentos at the cashier immediately after your meal. So the reason is because, as I shared earlier, peppermint itself actually helped to loosen up the muscle that is reducing the chance of us having reflux. So when you have a very heavy meal or oily meal, taking some mints will help to reduce the gas inside the stomach, so you don't feel as bloated. So that is intentional for them to give mints to you so that you will feel not as bloated after you leave the restaurant. So this just summarizes the various types of food that is good for bloating on the right, and the food that is not so good for bloating on the left. We have covered a few of them already earlier. And lastly, is about mindful eating. You can find out more about mindful eating from Brahm Centre. Essentially, for mindful eating, what it does is actually to slow down in terms of what you eat. Actually enjoy the process of eating, chew your food properly and enjoy your food. If you do that slowly, right, you may then realize that you get full a lot faster than you think you would. So for example, if you have a plate of economy rice, if you practice this, you may realize that you are full after eating about half to 3/4 the usual amount you eat. The reason is because the information from our stomach to our brain, right? The signal takes a while to go up. So in general, it takes about 15-20 minutes for our stomach to tell our brain it's full. So if you have a habit of actually eating exceptionally quickly, because your work is very busy and you tend to gobble your food down in about 5 or less than 10 minutes, you tend to overeat. And you may not feel full after 10 minutes because the signal from your stomach has not reached your brain yet. But soon after a while, as you walk back to your office after that very quick lunch, as you walk, you then realize that, hey, you're getting fuller and fuller. You wonder why. That's because that's when your stomach have realized that it is actually very full already. And that's when it reaches the brain finally. So if you could actually slow down the speed for which you eat your food, you can then realize that you won't eat as much than you used to, and yet you will feel satiated and you will feel full. Yeah, so this is something that if you want, you can actually find out a bit more. So when dietary or lifestyle methods fail, this is when you probably may benefit from seeking a review by a doctor. Common medications are generally divided into antacids and acid suppression medication. So in this purpose of the talk, I will not actually focus very much on this too. One other thing that I wanted to share is about lactose intolerance, because it's actually very common in this part of the world. So lactose intolerant, is it just the minority or is it the majority of the population? So there is actually a study that showed that globally, 70% of the human population has some forms of lactose intolerance, and majority of the Asians actually do have lactose intolerance, just that, of course, most of our diet may not be very high in lactose, and everybody's severity is slightly different. And of course, as we get older, we actually tend to develop lactose intolerance, which is why when we are young, we drink cow's milk, we have no problem. But some of y'all may realize that as we age, when you start drinking cow's milk, you may feel the urge to have tummy pain, diarrhea, cramps after drinking cow's milk. So as mentioned, these are the common symptoms of lactose intolerance. And the reason why we develop lactose intolerance is as we get older, we don't produce so much of this digestive enzyme called lactase, which is essential to help us digest the sugar called lactose that is found in the milk. So when this lactose cannot be digested properly, it then causes some fermentation process in our intestines, which can actually irritate our intestines, causing a lot of cramps. It also causes a lot of bloating symptoms and also diarrhea subsequently. So what to do if one person have lactose intolerance? So I guess avoiding or limiting your lactose intake will definitely be useful. And in general, limiting is better than avoiding. It doesn't mean that if you have lactose intolerance, you can never take cow's milk. You can, but in moderation, which I will share a little bit more. There are certain types of dairy products that contains lactose but has lower contents, and if you have lactose intolerant, even if you take it, most people should actually be okay. So which is why some people may have problems when they take cow's milk, but then when they eat yogurt, or if they switch to skim milk or low-fat milk, which contain lesser lactose, they have no problems. They can eat it as per normal. Then, of course, hard cheese compared to soft cheese like burrata have a lower lactose content. Then in general, if you really have to take cow's milk when you have lactose intolerance, try to have a smaller amount each time, around 100 ml or lesser. And over time, if you really want to build tolerance against lactose intolerance, you can slowly increase the milk intake, because your body will try to adapt by trying to make more lactase. Yeah. But the process can be very uncomfortable for many people. Then, of course, lastly, if you combine your dairy products with meals, meaning if you drink milk together with your lunch or dinner, you may also find that your symptoms may be a lot lesser than compared to just drinking milk on its own. Lastly, I will just share a little bit about constipation and what are the common food that can potentially help. So in general, for constipation, there are three major things that will help with other than medication, meaning physical activities. If you lead an active lifestyle, it will definitely help to make sure that you go to the washroom on a regular basis. Having adequate fiber intake will be essential as well. And lastly, drinking enough water will be essential. So just wanted to share there's actually two different types of fiber, which can be divided into soluble fiber and insoluble fiber. A lot of what we know insoluble fiber are those vegetables that we eat, fruits that we eat. Essentially, this insoluble fiber actually helps to bulk up our stool so that it doesn't become so hard. And actually, when we pass it out, it's actually easier. Yeah, insoluble fiber are things that are actually found, in fact, in coffee, which is why some people, after drinking coffee, they may also feel that, hey, that helps me go to the toilet a little bit better, because the insoluble fiber actually attracts water, and when it goes into our intestine and make it into gel-like, and it helps to slow down our digestion and also lower our cholesterol as well. In general, having adequate fiber intake will also be helpful for people who have diabetes, because it helps to control the sugar and reduce the sugar spikes after a meal. Yep, so these are just some examples of what are the insoluble fiber and what are those soluble fiber. So for the best food to help relieve constipation, in general, kiwi is the one that has been shown to be one of the most useful in general. So fruits like kiwi, prunes, pears, all this actually contain a special type of sugar that is not being absorbed by our body. So what it does is it actually help to soften the stools so that it's easier for us to pass motion. So for some people who have constipation but do not want to take medicine, so what they have done is they may drink pear juice or prune juice to actually help them with the symptoms, because it works a bit similar to this medicine called lactulose, which is that very sweet liquid medicine that people drink for constipation. So this is the last slide. So in summary, gut health is intricately linked to other organ health. In order for us to be able to better take care of ourselves, we need to identify which are our common food triggers and avoid them if possible, and also to know which are the food that helps us actually relieve our discomfort. So for example, if you have a very full meal and you want something to help you relieve the bloated symptoms, right? You can actually have a hot peppermint tea, and that will help with the bloating. Lastly, it is crucial to eat well to have good health. So more fresh vegetables, fruits, and whole grain products, less alcohol, less red meat, and less processed food. So with that, I thank you for your attention.